Hi, my name is Lucy and I'm 49 years old. In 2022, I was diagnosed with atrial fibrillation after feeling very unwell for 4 years. So I'm a busy working mum. I work full-time with 2 teenage children. I like to be busy. I like going to the gym, walk the dogs, commute into London a couple of days a week and sing in a choir. So my life is very busy. That's how I like to operate. But I was definitely feeling that with atrial fibrillation, I was unable to do these things.
Hello, I'm Claire Martin and I'm a consultant electrophysiologist, which is a specialist in heart rhythm management, and I work at Royal Papworth Hospital and at the University of Cambridge. Atrial fibrillation is a rhythm abnormality of the heart. When the heart beats normally, the electrical impulses start in the top chambers of the heart, the atria, and they spread to the bottom chambers, the ventricles, in an organised manner, leading to a regular heartbeat. However, when instead the electrical impulses in the atria fire chaotically, they cause the atria to fibrillate or twitch. And this electrical activity then spreads to the bottom chambers of the heart in a less organised fashion, leading to an irregular and sometimes rapid heartbeat. You might suspect that you have AF if you feel your pulse and you find that it's fast or irregular. There's a whole other range of symptoms that AF can cause, including chest pain, finding it hard to exercise, tiredness, shortness of breath or dizziness or feeling faint. An ECG is really important to be able to diagnose AF, and this could be done by your doctor, for example at the GP surgery, but nowadays there are other types of ECG that are available, such as those on a smartwatch or a phone app, and that can be useful for diagnosing AF. Sometimes atrial fibrillation can come and go, and that's known as paroxysmal atrial fibrillation. But sometimes if people get atrial fibrillation, then it doesn't go away by itself, and that's known as persistent atrial fibrillation.
I was definitely having to do less in my life because I just didn't have that energy to do things. I had periods when I was short of breath or had a tight chest, like anxiety, or was very hot, and all of these were symptomatic with menopause or perimenopause symptoms. When I was going to the doctors, they were prescribing HRT to try and combat that, but of course my symptoms didn't go away. When I was really feeling quite unwell, I had an ECG done at the doctor's which highlighted that my heart rate was extremely high. I then went and had an echocardiogram which showed that my heart was enlarged and was explaining why I wasn't feeling very well.
The treatment options depend on your symptoms. For some people, it may be that they just require some medication, either to try and prevent them going into AF or to try and control their heart rate better when they do go into AF. However, for other people, it may be that what's most appropriate for them is a more invasive treatment to try and get them back into normal rhythm. And that could be a cardioversion, which is a controlled shock treatment to the heart. And this is useful particularly in the short term for getting people back into normal rhythm, but sometimes people need a longer term option to help them stay in normal rhythm. And then in these cases we usually recommend an ablation procedure, which is a procedure that we do here at Royal Papworth, where we introduce little tubes into the top of the leg, pass them up into the heart, and then perform some ablation or treatment to the heart muscle to try and prevent the triggers for atrial fibrillation and making the patient go into AF.
I was introduced to Dr. Martin, and it was her recommendation to go through the cardioversion and ablation procedure to correct my atrial fibrillation. One of the benefits of using this ablation technique was that it was less likely to damage the surrounding structures of the heart.
So pulse field ablation is a relatively new treatment modality for AF. The underlying strategy in the AF ablation for PFA is still similar to other ablation techniques, in that the main aim is to electrically isolate the electrical signals in the pulmonary veins, which are the veins that are running from the lungs into the left side of the heart. Pulse field ablation is certainly an area of promise because of the way that it delivers the energy to the tissue. It actually more specifically targets the heart tissue than the surrounding structures in the heart, so for example the nerves and the blood vessels, and so it has less chance of damaging these other structures. AF ablations can be undertaken under local anaesthetic at the top of the leg with some sedation, or under general anaesthetic. And these options are discussed with the patient when they're seen in clinic beforehand. In either case, patients shouldn't eat or drink for 6 hours before the procedure. And then usually they come in on the morning of the procedure and they're admitted usually to the day ward, because we generally do these procedures as day cases. And the nurse looking after them will ask some background questions and prepare the patient, and then they'll put on a gown ready for the procedure. And then when it's time for the ablation, they'll be taken to our cath labs, which are like operating rooms but for cardiac procedures. And there will be a team of people in the lab. There'll be the doctor, they're usually 2 nurses, so there will be a few people there in the room. They'll be there to put the patient at ease. And then when we start the procedure, we put in a few tubes or catheters in through the top of the leg, and then we pass these up into the heart. Patients generally aren't aware of this after that because we've put local anaesthetic at the top of the leg, or if they're under anaesthetic then they'll be asleep. And then we'll do the procedure. It usually lasts between 1 or 2 hours. When the patient wakes up or at the end of the procedure, we'll just need to put a little bit of pressure on the top of the leg to stop it bleeding there. Sometimes we put 1 stitch in the top of the leg, which comes out 2 hours later. So the patient then goes back down to the day ward, and the nursing staff there will look after them. They have to lie flat for a couple of hours afterwards just to prevent any bleeding at the top of the leg, but the nurses will let them know when they can sit up gradually, and then they can get up and about and can eat again. And usually patients go home the same day, usually about 4 hours after the procedure is finished.
The ablation procedure took place for 1 day only, so I went in early to the hospital, met with Dr. Martin, who walked through the procedure. I had a general anaesthetic, and later that evening I was able to leave the hospital. I immediately felt better, and the general feeling of the operation, there was a small pea-sized lump in my groin that disappeared very quickly. Since the operation, my quality of life is 9 out of 10. I'm able to do the things I want to do, working in the garden, walking the dogs, going to the gym. It has massively changed my life, and at 49, I didn't want to feel restricted or unable to be with my children, to work, to be busy and enjoy time with friends. My advice to anyone who is diagnosed with AF, keep going to the doctor. Follow up on your symptoms. Don't ignore it. I think women of my age often keep calm and carry on.
It's very important to continue looking after your health in the long term after you've had an ablation. If you have high blood pressure, it's really important to make sure that that's under control, and also if you have diabetes or any other medical conditions that could be contributing.
The ablation procedure has enabled me to live a happy and active life.